Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Your GP has referred you to me to discuss your anxiety, so tell me, how have you been?
Feeling well. I'm still suffering from the anxiety and panic attacks and the medication that I'm taking. I found that it seems to have some side effects, and it makes me still feel a little on edge. So I found it better to take the medication at night rather than in the morning, and so I can get on with the day kind of thing, but I still feel quite anxious.
Okay, getting used to the medications can be difficult. When did you start the treatment?
3 weeks ago now, and that was the citalopram, the one to hopefully control the panic symptoms longer term, and the chlordiazepoxide, which is for the more short-term control.
How many of the chlordiazepoxide are you using a day at the moment?
Well, the doctor gave me 20 milligrams 3 times a day, but to be honest, I'm trying to cut them out. I only use them if I really, really need.
That's good. And do you feel okay with that?
Yeah, it's like, I don't feel like they suppress me enough. If you get what I mean, I know that my main aim to tackle this is, to be honest, is getting fit and more exercise, because I know that's the feeling that I need to aim towards, because I know from past experience that when I work out, I feel better, I feel more relaxed, etc. So I'm trying to work towards that. So,
how many are you actually having?
Today, I've had to go into work just for a conference with my manager, just to discuss how things are going and stuff. So I had to take 2 because I just felt like I couldn't manage it otherwise.
Right. Okay. So over the past 4 or 5 days?
None except for the 2 today.
So you've actually been laying off them altogether?
Yeah, I've been trying. And when I do take them, I only feel suppressed for a very short amount of time.
Right now, the citalopram medication.
Yes, I'm on 20 milligrams once a day, and the side effects, headaches, were quite bad to begin with, and I'm still getting them. But I think that could be more stress-related because they're not, I wouldn't call them painful headaches. I just can feel they're there. I also had a sore ear, so I wondered if I might just have an infection or something too.
Okay, we'll come back to that. But you're now taking this citalopram at night.
Yeah, I found that if I take it first thing, when I get up, I still feel quite edgy, and also the side effects.
Yes, okay. Right now, the reason you started the treatment was because you were getting full-blown panic attacks. Can you tell me a bit more?
About the attacks? Yeah, well, I couldn't leave the house. My heart races, and I really struggled to breathe. And I just feel an intense fear. It makes me feel sick and dizzy if I go out into the
You find it very difficult to get out and about. Are you beginning to normalize, do you think?
Yes, I've managed. I went over to the soup store on my own, and I managed. I felt a bit jittery at first, but, I've learned over the years after suffering quite severely with them years ago that you just have to take your mind to a different place. And, I just concentrated on what I wanted from the shop. That was the first time I've been out on my own since I started on the medication.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So how can I help you? I just came for a regular checkup for a suspected case of glaucoma 18 months ago. Dr. Gonzalez advised me to undergo a precautionary checkup once a year, knowing my family history of glaucoma, and after examining my eye, he told me that my optic nerve is thicker than the usual. That's probably the reason you were asked to undergo a precautionary checkup every year. You can have the visual field analysis and optical coherence tomography, OCT, today. The two tests would cost you £200, and you'll get the test reports in around 3 hours. Is that okay with you? That's fine. Please be seated here. Someone will call you back for the first checkup in just a few minutes.
Thank you, sir.
Hello, Miss Dominica. I hope you had a good experience going through those two tests.
Yes, it was. And since I've taken the test before, I know what to expect.
Your test reports are perfectly okay. Since these reports haven't shown anything suspicious in so many years, I think you can now take these tests once in 2 years and not every year.
Okay.
Well, that puts the glaucoma thing to rest. Do you work on the laptop for long hours?
Yes, doctor. Being the chief accountant, I have to work all day on computers.
If your eyes become tiresome very quick, I will recommend an eye drop that can be applied thrice a day. Generally, the eyes become tiresome when we continuously look at the computer screen without blinking for long. In such a case, this eye drop would lubricate the eyes.
Actually, I see a few black, thin, wavy structures floating before my eyes that don't disappear even after closing my eyes. What are they? Will it cause any serious problems to my eyesight?
Not actually. They're called floaters as we age. Floaters develop to different extents. They're not harmful, actually. Floaters may appear like gray or black specks, cobwebs, or strings that float during eye movements and appear to break away when you look at them directly. Generally, most eye floaters are caused due to age-related changes that occur as the jelly-like substance called vitreous inside the eye becomes more liquid.
Are they very serious, doctor?
Getting a new floater or the appearance of light flashes are the signs of the four. The vitreous gel is pulling on the retina. That can lead to a retinal detachment, a serious condition that can be treated with a surgery.
Can anything be done about the floaters in the eye?
Rarely, floaters may become very dense and plentiful and affect the eyesight. In such cases, a surgical procedure called vitrectomy may be suggested to remove floaters from the vitreous. A vitrectomy is performed to remove the vitreous gel along with the floating debris from the eye.
How can I get rid of floaters, doctor?
Normally, most of the eye floaters don't require treatment. It requires some patience and caution to get rid of them over time. When floaters become so large or numerous, they can impair the vision.
What kind of vitamins will be effective to treat floaters?
Although our government doesn't approve the Food and Drug Administration for treating floaters, there is anecdotal evidence that intake of vitamins can improve the eyesight and reduce the dominance of floaters. You can take vitamin A6, elements that include selenium, magnesium, and DHA, as these nutrients help to treat floaters.
Can you suggest to me some foods that will be effective to control my eye floaters?
Well, you can indulge leafy green vegetables like spinach, kale, and collards in your meals. You can also have salmon, tuna, and other oily fish, eggs, nuts, beans, and non-meat protein sources. Citrus fruits or juices such as orange, oysters, and pork in your diet.
Thank you, doctor. Thanks for your time.
You're welcome.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
So you've had a recent ankle sprain. Has there been any difficulty moving around?
It's been tough getting around. My ankle feels weak and I'm afraid I might fall.
Are you experiencing a lot of pain?
Not a lot. It's more uncomfortable than painful.
Any problems with swelling? Are you following the RICE protocol? Rest, ice, compression, and elevation?
Yes, I've been doing that, but my ankle still looks swollen.
Is it bothersome?
Yes, and it's making it hard for me to wear shoes.
I see. We might need to adjust your treatment plan and give you some exercises to help with the swelling.
I would appreciate that.
Now look at question 26.
Good afternoon. How may I assist you today?
Well, I've been experiencing some discomfort in my eyes. I've been working long hours on my computer lately.
Have you experienced this issue previously?
No, it's the first time. My eyes feel dry and tired, and sometimes I get headaches.
Yes, those are common symptoms of digital eye strain. Have you tried any remedies?
I've used over-the-counter eye drops, but I don't want to rely on them too much.
You're right. Eye drops can provide temporary relief, but we need to address the root cause. Have you considered blue light glasses or adjusting the lighting around your workspace?
I haven't, but I'm willing to try anything at this point.
It's definitely worth considering. Chronic eye strain can impact your vision in the long run.
Okay, I'll look into that. Thank you for the advice.
Now look at question 27.
So, have you noticed any changes in your coordination since we began your therapy?
Well, I've been struggling with my left hand a bit. It doesn't listen to me as much as it used to.
Does it frustrate you?
Yes, I used to play guitar, but now I can't hold the strings right.
Have you had any difficulty with everyday tasks? I know we've been working on improving your hand dexterity.
Yes, buttoning shirts or tying my shoes has been a real challenge, and it takes me forever to do it.
So it's quite bothersome?
Yes, it's frustrating not being able to do things I used to do easily.
Well, I think we need to adjust your therapy exercises. Make them more specific to the tasks you're struggling with, especially since you're having difficulty with your daily routines.
I'd really appreciate that.
Now look at question 28.
Good afternoon. What can I assist you with today?
I've been struggling with my cholesterol levels. My doctor told me to adjust my diet, but it's a bit hard.
Have you encountered this issue previously?
Yes, I've had high cholesterol for a few years. I try to cut down on fatty foods, but it's difficult, especially with all the social events I attend.
Well, diet certainly plays a role in controlling cholesterol levels, but it's not the only factor. You're doing the right thing by being cautious. Have you ever spoken to a professional about a tailored diet plan?
No, I haven't. I tried a few diet plans I found online, but they didn't seem to work.
Well, I would recommend consulting with a professional who can create a tailored diet plan for you, taking into consideration your lifestyle, preferences, and specific health needs.
That sounds like a good idea. Thank you.
Now look at question 29.
You mentioned the severity of COPD in patients. How do I identify the signs?
It's essential to understand the guidelines, but also know that diagnosing COPD is a complex task. Dyspnea, or shortness of breath, is a common sign, but it may not always be present, or might be difficult to evaluate if the patient has coexisting conditions like cardiac diseases. Sometimes the patient might complain of a chronic cough or fatigue, but doesn't show any other symptoms. If there's any suspicion of COPD, don't hesitate to refer them for pulmonary function tests. Many times exacerbations occur post-discharge, so ensure we regularly monitor the patient's lung function and provide them with appropriate medication before they leave.
Now look at question 30.
As we know, A lot of our epilepsy patients find it challenging to track and report their seizure episodes, leading to poor management of the condition. During our investigation, we found that the patients were missing their medication schedules due to the random nature of seizures. We can't predict seizures, but with the advancement of wearable technology, we can detect them as soon as they start. Our trials indicate that more than half of our patients using wearable devices adhered better to their medication schedules and could manage their condition more effectively. This is a significant improvement, considering that previous studies showed limited benefits for high-risk patients from costly interventions and complex seizure prediction models.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
My name's Dr. Maria Scott, and I'm a psychologist. Today, I will be discussing the impact of digital technology on mental health, a significant yet often underestimated issue in our rapidly evolving, tech-dependent world. The advent of technology and the rapid expansion of digital platforms has led to a digital revolution that has penetrated every aspect of human life, including healthcare. In the past decade, smartphone usage skyrocketed from a mere accessory to an indispensable part of our daily lives. With the rise in social media platforms, online gaming, and other digital platforms, there has been a significant increase in screen time, especially among the younger generation. While digital technology has indeed brought numerous advantages, there is a growing concern about the potential adverse effects on mental health. Evidence suggests that prolonged screen time and high frequency of social media use can lead to symptoms of anxiety and depression. Among teenagers, excessive use of social media has been linked to poor self-esteem, sleep problems, and even suicidal ideation. Simultaneously, cyberbullying, a byproduct of the digital age, has escalated, amplifying these mental health issues. Interestingly, while the overuse of digital technology has been correlated with an increase in mental health problems, it's not all grim. The landscape of mental health treatment has evolved, with the introduction of teletherapy and digital mental health apps, which are increasingly being used for diagnosing, monitoring, and treating various psychological conditions. But here lies a paradox. The very technology causing some mental health problems is also presenting solutions for others. There have been promising developments in the field of digital mental health. Mobile applications such as cognitive behavioral therapy, CBT apps, have shown efficacy in reducing symptoms of depression and anxiety. Teletherapy or online therapy is also gaining popularity due to its accessibility and convenience, especially during the ongoing pandemic. However, with the rise of these new technologies, there is an urgent need for further research to understand their long-term effects on mental health. Currently, there is limited research and inconsistent findings about the effectiveness and safety of these digital mental health interventions. Moreover, there are concerns about privacy and security issues. Mental health data is sensitive, and data breaches can have serious consequences. So, while these digital tools are potentially transformative, they also require thorough scrutiny, ethical guidelines, and robust regulation to ensure they are safe and effective. In conclusion, the relationship between digital technology and mental health is complex and multifaceted. While technology has the potential to revolutionize mental health care, we must approach it cautiously, considering both its opportunities and challenges. The objective should be a balanced use of technology where we reap its benefits while minimizing its adverse effects. Now, before I proceed to
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, I'm Mark Johnson, a nephrologist working in the field of kidney disease research and treatment. Kidney disease affects millions of people worldwide, often silently, until its later stages. Chronic kidney disease typically involves the gradual loss of kidney function, which can have life-altering effects on an individual. During my years in medical school, the common understanding of kidney disease was that it was primarily a result of aging or genetic predisposition. And while these factors indeed contribute, recent research has shown that kidney disease can be multifaceted, influenced by lifestyle, diet, and even one's profession. Let's debunk a few myths about kidney disease. Many people assume that you can't prevent kidney disease if it runs in your family. While genetics do play a role, lifestyle changes can significantly
AVN Pharma Education.